Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica. Hello and welcome, Dr. Steve Mulholland here in Toronto, Canada. Welcome to Plastic Surgery Talk and our podcast series. Today's podcast is on skincare and anti-aging, two very, very fundamental elements to some of the most popular things we do, which is keep the skin looking young, keep it looking attractive, and turn back the clock on older skin. So what is preventative skincare, preventative anti-aging, or another term rather than rejuvenation, what is prejuvenation, and what's a good time to start? Really, there's two groups of patients that are good for preventative care. Young patients, patients in their late teens and 20s, just starting with healthy skin care, a good approach to eating and internal nutrients, beautiful skin from the inside out, using a good regime of a cleanser, a toner, and a moisturizer. It can even be non-medical, something that doesn't react to their skin. And of course, the most important thing, sun protection, using ultraviolet light protection, sunblock, SPF 30, 40, 60, staying out of the sun and wearing a hat. That is the most important part of prevention. Now, as you get a little older, let's say late 20s, early 30s, preventative skincare can start to incorporate some more medical therapeutics, things like the injectables and energy-based devices. So by injectables, I mean using small, really small, baby amounts of Botox in preventing the frown lines, the crow's feet, and the worry lines that may occur with age. And if you start young, the lines you see your mother have or your parents have, you'll never form them. So using Botox in very small amounts to prevent the lines that will eventually would have come. Using energy-based devices, lasers, radio frequency energy systems, ultrasound systems to pre-treat early rosacea. If you have a hereditary tendency to red discoloration, pre-treating to prevent that rosacea from getting any worse and stopping it in its tracks. Using other energy-based devices for discoloration that's brown, the pigmentation disorders such as hyperpigmentation and melasma, and starting that before you get it. Using devices that stimulate collagen, things like radio frequency devices and fractional lasers to treat textures and pores or acne scars before they form and before they start. Using other injectable elements like stem cell stimulation with PRP, platelet-rich plasma, or the vampire lift, again, in your youth, before or as you're starting to see the early signs of aging, so halt those changes in their path. And literally, if you start young enough, lines you would have formed, the frown lines, the worry lines, the crow's feet, the loss of volume, T-zone pores, can all be stopped and permanently delayed before they form. Of course, then there's the group that has gotten old. They start getting enthusiastically involved in plastic surgery, non-invasive, invasive treatments. And we do a procedure or some procedures, maybe some cosmetic facial surgery, blepharoplasty, brow lift, neck lift, cheek lift. We do some fractional lasers on the skin, some Botox, some fillers, and they look great. Then they want to protect their investment and prevent aging from the more youthful position that we created. And again, it's the same hierarchy of options. Skincare, now probably medical skincare, things with growth factors and peptides and prescriptives for pigmentation. Energy-based devices, microdermabrasion, red and brown discoloration prevention, neuromodulators such as Botox and fillers, and the soft tissue volumizers. We can use all those devices after an anti-aging surgical procedure to protect your investment and to prevent the aging process from further deteriorating what you invested in. So those are the two large groups: young before it starts, and a little older after you've created that youthful look and protecting your investment. Okay, so now what? You're committed to the anti-aging process. You're younger, middle-aged, or older. What devices, what weapons do we have to treat the aging process? You can divide them into skincare and topicals, energy-based devices, and injectables, and suture suspension support. And so by having different products and services, we can really attack the aging process, which is really divided into the 3 Ds of growing old: deflation, descent, and deterioration. So deflation is the loss of volume, air out of the balloon. Without air in the balloon sags and gets wrinkly. And so with sun damage and time, you get discoloration. So you get deterioration, descent, and deflation. Of course, when we look at then of our treatment tools, our weapons against this 3D, we need 3D therapy. And so we can divide our assault into topical elements such as medical grade skincare, such as Universe Skin or SkinCeuticals or Obagi, the products that have active ingredients over and above the strengths you get over the counter in a Walgreens or in a Shoppers Drug Mart, and will actually give you something you can use at home. Then we introduce the injectables, the Botox type products that minimize animation in the muscles that create the creases. And then soft tissue fillers like Juvederm or Restylane, where we can create volume and support for the air that's gone out of the balloon. And by integrating those two, we can really create a very youthful look to the face. We can layer on top of that again energy-based devices, lasers, light devices, intense pulse light photofacials, fractional devices, skin tightening devices that are either RF, laser, light, or ultrasound, and we can make tighter, firmer skin, and skin that has less discoloration, less red and less brown. So we put all that together, we can do 3D therapy with a number of energy-based devices, injectables, and skincare, and without even using a scalpel, create significant youth. We can often turn back a 50-year-old face 5 or 10 years, a 60 or 7-year-old face 10 or 15 years without any scalpel. The last element in my anti-aging preventative non-excisional option is suture suspension using bioabsorbable threads to take the volumized, neuromodulated, and energy device reduced aging and lift it without excision with suture support threads that tend to dissolve then over 60 days once the lift is firmly taken. And so we've got tremendous options now for the anti-aging, non-excisional restoration of youth and beauty. You just need to decide where you're going to be on that entry level, get a good consultation from a plastic surgeon or dermatologist, and begin the anti-aging process. So skincare and anti-aging is really treating intrinsic aging, which are the signs of aging of your face that would occur without any sun damage, and that's loss of volume, wrinkles from overanimated movement, and the intrinsic loss of support of the elastin and collagen as the tissue sags. What it doesn't include then is the extrinsic causes of aging. The extrinsic causes would be things that you do to yourself, environmental factors, weight loss, weight gain, multiple parity, smoking's a big one, ultraviolet light damage. And generally, we tend to use more energy-based devices for these extrinsic causes, the photo damage, the solar elastosis, the wrinkles, the fine lines, and the discoloration from sun damage or from underlying inflammatory conditions like rosacea. So we use photofacials and lasers to smoothen out pigment, even out tone, and tighten skin. For the intrinsic aging, which is usually volume loss and laxity, we'll usually use devices like internal heating devices and volumization to bring back youth, and then Botox to soften the intrinsic aging from animation. And so you can think of your preventative and your therapeutic skincare and non-excisional treatments as addressing aging from extrinsic causes and the internal biologic clock aging. And most patients that we do see, most viewers, have a little bit of both that needs to be treated. So how do you purchase these services? Let's say a clinic like mine has all kinds of things we offer. Skin care, for Botox, we offer soft tissue fillers, we offer multiple energy-based devices under different categories: radio frequency, laser, fractional laser, intense pulse light, ultrasound devices, suction coupled devices, and we also offer then suture suspension and volumizing products. How do we integrate that? Well, you can buy and pay as you play each individual item. Some people come in just for a little Botox. They might come in just for some soft tissue fillers. They might come in just for some skin clarity and laser treatments. In other ways, we very commonly bundle things together in the best possible package that addresses all of your concerns. So we tailor and customize in a very bespoke fashion a unique blend of energy-based devices, skin care, neuromodulators, i.e. Botox, and soft tissue fillers to customize that treatment program to the needs of your aging elements and face for a very unique and rejuvenative procedure that's different for everybody. So how do you select the right physician for you for this anti-aging quest, this journey? Probably a specialist like a plastic surgeon, a dermatologist, a facial plastic surgeon, a committed core specialist to beauty in the skin. Now sometimes there are good Non-specialists, family physicians who have specialized in cosmetic medicine are also very good. A non-typical specialists like gynecologists and other surgeons that will have ventured into cosmetic plastic surgery, but typically plastic surgeon, dermatologist, face-to plastic surgeon. You want to make sure they have a wide array of weapons against aging. So they want to have a full non-surgical center that includes all the things we've talked about: skin care, energy-based devices, injectables, soft tissue fillers, suture suspension techniques. And then also, if you're fortunate, you've got a surgeon, a plastic surgeon or a facial plastic surgeon or a derm surgeon that can offer small excisional procedures to complement the non-surgical. Or as you age and progress and the non-surgical is not enough to create the rejuvenation you want, you can add a blepharoplasty, a brow repositioning, a cheek lift, a neck lift. As you age in different decades, different tools, including finally scalpel-based rejuvenation. So look for someone with experience, look for someone with a good reputation online, look on reputation sites such as RealSelf, Yelp, CitySearch, Facebook, Google+, RateMD. Search out the board certification, the college if they're certified, what's their specialty, any complaints, any malpractice suits. Do they have lots of testimonial patients, great before and afters, and do you have good word of mouth referral systems, either online from people you don't know that say great things about them? Are they in the media, and do they have great before and afters when they do those kinds of health-based shows? And when you do your consultation, do you have a wide array of options that you can select from? And is there a discussion of the risks and the benefits? Affordability obviously becomes part of the equation. Generally, the better physicians that are in demand will tend to be a bit more costly, but sometimes you get what you pay for. So there's a lot of elements that you should search out when doing your research. With the internet now, I think there's lots of opportunity to research your physicians long before you present for a consultation. So most of the barriers to a successful relationship are eliminated by research online, and then a live consultation with the physician to get feedback specifically on what your needs and solutions may be. When you've taken a skincare preventative approach or a energy-based device injectable approach, generally it's common to be asked, well, what are the costs of these technologies and treatments? And I think relatively they're quite affordable compared to the surgical options. They're certainly risk reduced and recovery reduced. Most of the treatments allow you to go right back to work that day or the next day. There's a small risk of swelling, redness, or bruising, but generally camouflageable. Most of your skincare products are sold by physicians and have physician strength. Usually going to cost you about $250 for a good medical skincare program about every 4 months or 3 times a year. When you look at how much you spend on your nails, pedicure, manicure, skincare with estheticians, and hair care products, spending that amount on your skin to look significantly more youthful is generally money well spent. Once you start layering Botox and soft tissue fillers, the ranges can be several hundred a year to several thousand a year, depending on the volume and the needs of those injectable elements. Energy-based devices, usually a good anti-aging program is in the $2,000 or $3,000 range once a year. And suture suspension techniques, usually like thread lifting, will be half the price of the surgical option. So generally quite affordable if you're committed to the best possible rejuvenation that you can achieve. It's going to involve some of those elements and stepping up your game over and above what you get at a Walgreens or a drugstore and an over-the-counter experience. Usually affordable, and the return on investment is the youth and the beauty that you purchase, that you achieve through those physician interventions. So thank you again for joining me, Dr. Stephen Mulholland, here in Toronto, Canada, on Plastic Surgery Talk for our latest podcast installment on skincare and preventative non-surgical treatments for pre and rejuvenation and looking great and youthful forever. If you found this to be informative, entertaining, and interesting, please share this on all your social media channels, and we look forward to seeing you again here on Plastic Surgery Talk. Thank you.